What is your name and how long have you worked at Baylor?
My name is Iwiller Hendrix. I've worked at Baylor 6 years.
And what do you do at Baylor?
I'm a buyer in the Heart and Vascular Hospital.
Okay. And why did you want to volunteer to be a contender?
Basically for that accountability, somebody to sort of shock me or kick my butt when I'm losing focus, and I needed that.
Okay. What are your main goals this year?
This year, I don't know if it's this year as much as it's week by week, and if it progresses to the year, that's fine, but week by week is just to stay focused and lose a couple of pounds a week.
Okay, so weight loss?
Weight loss.
Okay. In the past, have you ever tried to slim down before, or is this your first journey with weight loss?
I have tried to slim down several times, and I'm always successful the first month, a week or so, but as I said, I get derailed. I get derailed each and every time. And I think this program, I'm hoping that this program will help me stay on track.
Now, when you get derailed, like you said, what typically derails you from your weight loss goals?
Emotions, stress, work, at home, those type of things.
And exercise is the first usually to go?
Truly the first to go.
Okay. Was it applying for being a contender that was your aha moment, or was there something that happened that triggered your thought of, okay, I got to get back on track, I've got to lose the weight?
Well, I would have to say there were several aha moments, and one being that I have to get back on track. Another being that Baylor instituted a no smoking hire program. And the reason was for health reasons. How could we educate patients if we weren't following a regimen for health? And so you have to read into that. Well, if they're talking about smoking and all the effects of that, then weight-wise, how can you tell someone? So I read into that. And so that was another aha moment that I needed to do something.
Okay. So what's going to be your biggest temptation? You already mentioned work stress. Is there maybe home stress as well, but is there anything else that will derail you? For example, some people, it's going on vacation and they get off track a little bit, or
No. I do. I have my moments, but I don't think that I've never been one to. I don't think that you have to go on this crazy diet. I think that you should eat what you want, but eat it in moderation, not eat as much. So I don't have that. It's just that when that stress overwhelms me and it just takes over, and everything else is laid by the wayside. Okay. So I don't think it's a diet issue.
So it's just consistency.
It's just consistency.
And it sounds like mainly with the exercise. What are you doing now for exercise?
I do the 6 flights of stairs every 2 weeks.
Okay.
I do this little small elliptical I have, and I'm trying to get my treadmill working.
Okay, good. So with the exercise, that sounds like it's the main thing. As long as you're consistent with that, gradually increasing, what you're doing, what will you do differently when that stress happens this time around to stay on track? Because stress will come.
Stress will come. I'm hoping that with this program, it's what I need, that I'll be willing to pick up the phone or send an email. And for someone to say, okay, Iwiller, you've been here before, we can work through this. And I think that that's what I need. And I've reached for that previously in all my trials, but there's not been anybody there consistently, so maybe this program will put that consistent support.
Mm-hmm. That's the key word, having that support system.
Yes. There
is what's going to help you. And knowing that there's somebody there, that you're not alone. And let's say in the future, like you said, your main focus is to just take it week by week, stay on track week by week. If that plays out and you reach out for support when you reach those stressful times that normally derail you, what are you hoping to accomplish, a year from now? How will you know, or even 6 months, a long-term goal, how would you know that you're satisfied with your goal? Is it clothing size? Is it something you can measure by endurance? Is it the way you look, confidence? What are you hoping will?
Well, it would have to be all of those things. I don't know if one would outweigh the other, but it would be weight loss. It would be a new wardrobe. It would be endurance to do more things. But I think that with all those things said, it would have to be me being comfortable with where I am at that point.
Okay. So with today, here we are, the third week of February, and like you said, you're mainly doing 6 flights of stairs a week. Is that right?
2 days a week.
Okay, 2 days a week.
Uh-huh.
So 6 flights of stairs, 2 days a week. And if we were to revisit you here in the next, couple months, what would you like to accomplish at that point?
At that point, for the stairs itself, I would want to at least be up to 4 days.
Okay.
And my goal is to do it every day I'm at work. But I would at least, at that time period, want to be 4 days a week.
And I think those are great goals. You have several different things that will keep you motivated, with watching the scale number go down, watching the clothes fit a little bit more loose, having more endurance, sleeping better. As of right now, where you sit today, this being the first day, what's your confidence level on a scale of 1 to 10, 10 being I am so confident this is going to happen, 1 being I don't have really much faith at all?
Well, I am confident this is going to happen. I wouldn't be here. That I need, even to be here took a lot of confidence. Even to be in front of this camera takes a lot of confidence for me. So I'm very confident. It's when I get to the point that I start falling.
Okay.
And that's when I need somebody to say, hey, you remember, you were confident, let's get back to that point. And that's what I need.